People with Dercum's disease have many fatty nodules on their body. Sometimes a patient will come to me and say, I know I have 3 large lumps on my body and they're painful. Do I have Dercum's disease? And what I find is that the lumps appear in a background of much smaller lumps. So if you palpate the tissue around the lumps that they noticed, you can actually feel smaller nodules in the tissue. And it tends to be very diffuse and pervasive, these small nodules in the tissue. If a person just has a single lump in their tissue or maybe 3 nodules on their body, it's unlikely that it's Dercum's disease. However, with that caveat, some people with Dercum's disease who have thousands of lumps on their body have family members with 1 lump or maybe 3 or 4 lumps. But in those family members, they're not painful at all. So there's something different that's happened to this person who has Dercum's disease, something different in their genetics that has allowed these lumps to progress. Also, I meet a lot of women who have lipedema, who have lumps in their tissue, and they wonder if they have Dercum's disease. And really, we don't have the answer to that. In my opinion, if a woman has disproportionate fat on her body, she's smaller on the top, larger on the bottom, her tissues are heavy, she has many diffuse small nodules in her tissue, and 1 or 2 large lumps, she still has lipedema. She does not have Dercum's disease. Dercum's lumps appear on the body all over. They can appear on the arms, the back, the chest, the abdomen, and the legs. They also can appear on the head, the hands, and the feet, but much less often. Typically, the lumps appear on the chest, usually on the side of the ribs, but many people also develop lumps on their forearms or possibly on a thigh or a lower leg. But I would say the most common part of the body where a lump will develop in Dercum's disease is on the chest. The things that tend to slow down the lumps, in my opinion, that I've learned after working with my patients over time are, 1, diet. So people who are eating a very clean diet, and by a clean diet I mean lots of healthy fruits and vegetables and lean protein. You don't necessarily need to go towards a vegan diet, but reducing the amount of meat that's eaten, maybe to 2 or 3 times a week, or eliminating it altogether. Some people are able to do that. The second thing is making sure they get lots of exercise to help the lymphatics continue to function. And the third is some supplements that they can take, that actually come from food, to help improve inflammation, decrease reactive oxygen species, improve lymphatic pumping, and also decrease the amount of leakiness that we find in the capillaries and the lymphatics. These include selenium, which they can get by eating Brazil nuts, arginine, which they can get by eating walnuts, and also another supplement called diazomin, which is found in the rind of citrus fruit. So there are some doctors that are able to diagnose patients with Dercum's disease. These doctors tend to be dermatologists, some are rheumatologists, some are surgeons that have removed the fatty lumps from patients with Dercum's disease and have researched it further. One of the things that I did to help doctors better understand Dercum's disease was to write a white paper. And what this white paper does is it lists many of the studies that are available to us in the literature about Dercum's disease. And it gives some of the evidence that Dercum's disease is a real entity, that it exists, and that there are treatment modalities that can help. So I would suggest to patients that they carry that white paper with them and that they find a doctor. It really doesn't matter what kind of specialty that doctor is in, but just that the doctor or other healthcare provider, like a nurse practitioner or a physician's assistant, is willing to help them get better in terms of their Dercum's disease. I think there might be some individuals in support groups that are good resources and can kind of weed out the emotions associated with Dercum's disease from published criteria or really good anecdotal reports. But unfortunately, there's no group that I know of that has, for example, physicians that are part of a group, along with patient advocates, for example, that could then work together to bring this information to the public. We don't have that. I'm not exactly sure how we would go about making that happen, but I do think that that is really important, and also to have a collection of information on Dercum's disease, which the Fat Disorders Research Society does have. People with Dercum's disease have good days and they have bad days. On the good days, they tend to overdo, and then the next day can actually end up being a bad day where they end up in bed and they just can't get out. So the things I think to do to make sure that people with Dercum's disease have more good days are, number one, when you do have a good day, you have to actually take it easy. You can't overdo, you can't do all the things that you were unable to do in the days past. Number two, I think you have to eat really healthy food. And make sure that you're not overeating, because when you overeat, it tends to stimulate inflammation, and that can actually make the next day worse. I think at the end of a good day, they should do something like swimming, whole body vibration, manual lymph drainage. They should get in a sequential pneumatic compression pump, and they should really treat themselves to get rid of a lot of the lactic acid that they built up during the day and a lot of the toxins that they ate during the day, so that they can be ready for the next day. They also need to get a really good night's sleep. There are some reports of liposuction for Dercum's disease in the literature, and if we look at a pain scale of 0 to 10, 10 being the worst pain you ever had and 0 being no pain, liposuction can actually reduce overall pain by a point, which may not seem like much, but when you're living with pain every day, reduction in a full point is actually a lot. The only problem with liposuction for Dercum's disease is that it tends to recur. So people have to be prepared that the liposuction and the liposuction effects for reducing pain are not going to be sustained over a long period of time. I think we really need to better understand liposuction for Dercum's disease. It does seem to require some different methodologies, and it may be actually better to remove a larger amount of tissue rather than to undergo liposuction, but we just need more research in this area. And I think really you have to personalize that treatment to the patient. There is some research going on in Dercum's disease. I collaborated with a Swedish group at the Karolinska Institute, and our goal is to phenotype people with Dercum's disease very accurately and also do some immune investigations. So we're going to be looking at all of the inflammatory cells in people with Dercum's disease to see if any of the inflammatory cells are involved in the disease process. And that is going to drive treatment modalities, and that actually is going to be starting in the fall of 2015. We are actually actively raising money for research. I do have some research money right now for Dercum's disease, and our goals are to repeat a questionnaire that I've done in the past to see how people progress in terms of Dercum's disease, to phenotype people with Dercum's disease, and also try and learn about different treatment modalities, for example, stem cell infusions in people with Dercum's disease. People with Dercum's disease tend to have pain as their main complaint, and treatment of pain is very personal. What works for one person may not work for another. So treatment modalities for Dercum's disease tend to start with non-steroidal anti-inflammatories, which means like ibuprofen or naproxen or Tylenol or aspirin. When these fail, they tend to move on to antidepressants, for example, Cymbalta. They also can involve nerve-specific pain medications such as Neurontin or pregabalin, and those actually have been very successful in improving pain. People also tend to use opioids, and that can be pretty risky because people with Dercum's disease have a really high level of pain, and the amount of opioids that they can take can rise dramatically. And that's a big concern because opioids suppress their breathing center in their brain. And I've lost a couple of patients who have Dercum's disease because of the use of opioids. Another treatment modality includes the infusion of lidocaine by IV or ketamine by IV. Lidocaine is typically used as a numbing agent when you have your tooth treated by the dentist or for surgical procedures. And for some reason, because lidocaine affects sodium channels and nerves, it relieves pain in Dercum's disease, and it can actually last for months. Some people respond to lidocaine and some people don't. The unfortunate part about this procedure is that it has to be done by somebody knowledgeable. You have to watch the heart during the procedure because it can stimulate an arrhythmia, so not many centers actually offer that. Also, there's ketamine infusion IV that has been shown to work for a number of my patients with Dercum's disease, but again, unfortunately, not many centers do that. Things that help prevent or decrease pain in Dercum's disease include manual lymph drainage and compression garments. And we think that there's a lymph component to the pain. And swimming also helps improve pain. Whole body vibration helps to improve pain. Any kind of manual therapy on the skin, such as microcurrent or Hivamat or cold laser or low-level laser, these are all temporary pain modalities that are anti-pain modalities that people can use that have Dercum's disease.